Welcome to our series on global challenges, the pandemic, and the world order. My name is Nicole Bivens-Sidaka, and I'm the Deputy Director of the Masters of Science in Foreign Service program at Georgetown University. Our conversation today is about global financial markets and how the pandemic has impacted the financial markets, trade, commerce, and our entire global economic system. We'll be joined by faculty member Dr. George Shambaugh, who is the director of the Master of Science in Foreign Service program, and he will be interviewing Yong Kim, the co-founder of Partners in Health and the former president of the World Bank Group. He's also served as the former president of Dartmouth College and the director of the World Health Organization's HIV/AIDS department. I hope you enjoy our conversation.
My name is George Shambaugh. I am an associate professor and director of the Masters of Foreign Service program at Georgetown University. It is a pleasure to welcome viewers to another session of the Masters of Foreign Service Global Challenges Symposium. It is a great privilege to be joined today by Dr. Yong Kim. Dr. Kim pursued his undergraduate education first at the University of Iowa and then at Brown University. Then he completed his graduate work at Harvard University, where he received both an MD and then a PhD in anthropology. Dr. Kim co-founded the Partners in Health, which provided medical care to poor regions of the world and pioneered work on multi-drug resistant tuberculosis. He then applied these insights to work on HIV/AIDS at the World Health Organization, where he directed a department on HIV/AIDS and succeeded in providing antiviral drugs to 3 million HIV and AIDS patients. In 2009, he returned to academia and was named president of Dartmouth College. From 2012 to 2019, he served as president of the World Bank, where he focused on creating support for the poor, fostering emerging markets, and promoting innovations in development finance. Indeed, sir, this is where we first met. We met when I was working for Senator Todd Young, and we came to the World Bank to talk to you about efforts to promote innovation in development financing in the United States government and in the private sector. Dr. Kim is currently a partner at Global Infrastructure Partners, which is an infrastructure investment fund focused on energy, transportation, water, and waste sectors. You know, you bring such an extraordinary experience and knowledge with you. And I know you are deeply engaged in COVID issues as well as global financial issues. It really is a privilege to talk to you today, and many, many thanks for joining us. Today, what I'd really like to do is to get your insights on three big sets of issues. The first is the consequences of the COVID-19 pandemic for the global economy. The second is for you to share any lessons you think are pertinent from your experience fighting infectious disease. And the third is to share the lessons of your current activities with the state of Massachusetts and other entities with the students who are seeking careers in international affairs, in public health, and other related fields. So again, it's a pleasure to have you today. To start, I'd like to set a little bit of a baseline and ask you, how would you characterize the global economy and global financial system pre-COVID-19? What did you see as the principal challenges to the international system then that may have come to the fore since the crisis began?
Well, thank you for having me, Professor Shambaugh. You know, during the time that I was at the World Bank Group, we were observing carefully as countries, especially the largest advanced economies, were engaging in monetary policies that were truly unprecedented, negative interest rates, the bond buying programs. And so the looseness of the monetary policy over a very long time was itself unprecedented. I think some of the concerns prior to COVID were the level of corporate debt in China, in the United States. You know, with the very, very low interest rates, corporate debt was amassing, and there was talk just before COVID hit that there could be a reckoning, that another recession was you know, after 10 years plus of expansion, that this was, you know, a time in the business cycle for a recession to come, and that a lot of people were looking at the amount of corporate debt as one of the one of the things that would trigger that. So the global economy wasn't all upside before, and many of us were saying this expansion based on unprecedented monetary policy, in some cases unprecedented fiscal policy, was truly unprecedented. We didn't know what the implications were. I mean, just as an example, in Japan, the central bank has kept interest rates negative and continued their bond buying programs at an incredibly high rate, and they only pegged it to inflation. And they told everybody, we're only going to do this until inflation reaches 2%, but it hasn't done that yet. And so what are the implications of doing that for such a long period of time? Those were the things that we were contemplating before COVID. But then, of course, after COVID, the entire world changed. And still, to this day, I mean, I think we know so much more about the virus. We know so mumuch more about how to keep it under control. But I think, right now, in terms of what I'm reading and who I'm talking to, the only answer we can give is that we don't know. We don't know what the ultimate impact is going to be. I mean, I think there are, the global GDP has taken a hit, unlike any other period in history. I think we have to go back to the Great Depression to see hits like this. The other thing that is concerning, and we certainly talk about it in whatever way you want, but there's also what a previous Fed chair called the irrational exuberance. There's this kind of sense that a vaccine will fix all these problems. We can talk more about that, but I'm extremely worried about this overconfidence or over optimism and expectation for what will happen if there's some kind of a vaccine. Those of us who've been in global health and have tried to administer vaccines to large numbers of people, mostly in developing countries, but also in the United States, know that this is also very, very difficult. So, there were weaknesses before. There was this expectation that the business cycle would turn. There was a concern about unprecedented monetary policy, especially. All of that, of course, is much more worrisome now that we're 7-8 months into COVID.
Thank you very much. Indeed, the World Bank baseline forecast was for a contraction of 5.2% of global GDP, and that's going to have spillover effects to developing countries and emerging market countries as well. So there's really a ripple effect in this.
Right.
And that seems to be
taken. Let me just jump in right there, because that's an important point. Now, the World Bank group, the 5.2% reduction scenario was based on a scenario in which the peak of the epidemic would occur in July, right? And so that was their sort of mid-level analysis of what could happen. The current head of the International Monetary Fund was my deputy at the World Bank, Kristalina Georgieva, and I talked to Kristalina probably 2-3 weeks ago, and she said, yeah, when we saw that, we knew that was not going to be the case. And so the IMF's prediction is actually much worse than the World Bank's prediction. And so I think just about everybody right now is expecting, well, okay, so we couldn't believe that it would go into the summer. Now that it's in the summer, we can't possibly believe that it'll go past, first or second quarter of 2021. But, if you, again, I think that there are very few of us who've both done infectious disease and are in the finance and economics world. The few of us who I talked with have been very worried about the real irrational expectations so far of where we're going to be.
One of the striking things to me about this is it takes place on top of fiscal and monetary policies designed to try to adjust this.
Right.
In other words, we seem to have started from the precept, not only is it the COVID, a medical disease, but we can fight it with traditional monetary and fiscal policy akin to the financial crisis. And that seems to be a dubious.
And ironically, and not ironically, I think really tragically, there's been so little money for public health. And, I wrote an article early on saying what we need is massive spending so that we can build the system that will, that has now throughout the world been shown as the only thing that has kept the virus in check enough to get the economy restarted. And those are our existing public health measures. This is what WHO has been saying. This is what Bill Gates has been saying more recently. You know, sitting back and waiting for the vaccine is going to prove to be very, very what's the right word? Well, risky is the nicest word I can think for it. You know, every single country that has gotten their economies back up and running, every single country that's gotten this virus more or less in check has done it through the existing means, which is social distancing, especially mask wearing, and then widespread testing, contact tracing, and isolation and quarantine that's actually supported. In other words, when people go into isolation and quarantine, they have food, they have diapers, they have whatever they need. This is the only thing that has worked. And unfortunately, there are very few states that have got it up and running. Massachusetts is really the only state I know of that has gotten to the point where they've had too many contact tracers and had to go back a little bit in the number of contact tracers. Everyone else is struggling to get this up and running. And right now, because testing is still a major issue, we're not, you know, we're getting to the point where all the contact tracing programs will be useless because the tests are not coming back quickly enough. You know, if the tests don't come back within 48 hours, it's really useless in terms of being able to stop transmission. And so you said it exactly right. We are taking a fiscal and monetary approach to what is fundamentally a public health problem. And while we're spending trillions, you know, the trillions is just on fiscal stimulus. You know, not to even mention, you know, monetary policy, which has been, you know, as loose as the U.S. has ever gotten, and at the same time, no money for public health. You know, the Democrats, House Democrats, put up a proposal, the HEROES Act, which had $75 billion for what they call TTSI, testing, tracing, and supported isolation. But so far, that has been sitting on the desk of both the White House and Senator McConnell for all this time. There are very, you know, I think forward-looking senators and representatives on both sides of the aisle who are saying, "Hey guys, this is a public health problem. Let's go forward and let's provide some financing for it." But so far it hasn't moved. And that's, I think, the greatest tragedy right now, is that we fundamentally misunderstood the crisis, you know, and haven't really understood how it is that the countries that have gotten it under control have done it. Very straightforward. These are not new or high-tech interventions that we've known that this is the way to deal with pandemics for 100 years and more.
Are there particular countries or regions that you think are exemplars in terms of how to behave, or do you think are at particular risk?
Well, you know, the interesting thing is that now there are just so many different ways in which countries have been successful. So China had the biggest problem at first, and they have the biggest problem now in terms of logistics, 1.4 billion people. They have an extremely effective system. I think that it would be very difficult to implement that in Europe or in a democratic country, because it's so restrictive. Anyone going in 14-day quarantine, they track the movements of every single person in China. You know exactly whether you've been exposed or not at any given moment. It's highly effective, but you know, people who've lived and grown up in the United States might feel quite uncomfortable in that kind of system. Korea is different. Korea, they never shut down really their economy as a whole. They're a little bit more intrusive in that in 2014, 2015, they had an outbreak of MERS, M-E-R-S, the Middle Eastern Respiratory Syndrome. And that is much more deadly, much less infectious. And they fumbled that so badly that they changed the law. And the law in Korea now is that if there is an outbreak, like a pandemic or an epidemic, the government can then get records to your purchasing behavior, your credit card information, and your GPS data. So with that, they're tracking infections extremely closely. And because of that, they haven't had to shut down their economy. They've gone back and forth in terms of opening and closing their schools. But baseball is going. They're going to start having, fans in the bleachers, socially distanced, but they're going to start watching these games. They've done very, very well. New Zealand had the advantage of being an island. They didn't use face masks broadly, but they so strictly controlled the movements in and out that they've done very well. Australia has done very well, and they're also, like China, Korea, Taiwan, Hong Kong, they're trying to keep their cases at zero. But then you have a whole other set of countries in Europe that have said, okay, we're not going to be able to get to zero, but like in Germany, if we can keep cases to several hundred or less a day, then we can chase those down. And so they have elaborate testing, contact tracing, isolation systems, and they're able to run things down as they're hit by those different problems. Czech Republic is doing well. Greece is doing well. So many countries are doing well. But again, the thing that the basic elements of the public health response are done differently, but they're in place, and those economies are responding. China, for example, they're getting close to the baseline of where they were before, and everything is getting better. And so, as of today, not only are the industrial indices getting better, but consumption is getting better. Consumption is getting close to where it was prior to the pandemic. So if you keep the virus under control, even in a country as large as China, you actually can get the economy back up and running.
So thinking about those comparisons, which actors do you think are the most pivotal in promoting a positive response? Is it the federal government? What role could a private sector play? How can you mobilize public behavior in a particular way in a democratic system where you don't have as much an explicit lockdown?
Professor Shambaugh, the thing that I've seen happening, which is just so tragic, is that people don't know who to believe anymore. There's just this sense that there's so much information coming at them. And I think this has been multiplied by the fact that we live in this social media time. People don't know what to believe. And so I've talked with, very well-educated people who are coming to me with, from the perspective of a trained infectious disease physician, like myself, just sound absolutely crazy. But because so much information is out there, they don't know what to believe. They haven't had years of training in medicine, in the analytic and research methods that we learn as medical students of how to assess data. And so they're coming to me and saying, well, what's going on? I had a very interesting conversation with Mike Milken, and this is online somewhere. And Mike said it to me just as clearly as you could imagine. He said, and Mike is someone I worked with very closely when I was at the World Bank. Mike said, we just don't believe you guys anymore. He said to me, Oprah Winfrey said in 1987 that 20% of Americans would become infected with HIV. Now, I told him I cannot take responsibility for Oprah's public health pronouncements. But then he said, but the other thing is, you guys told us that the hospitals in LA would be inundated, and he's an extremely generous benefactor of many hospitals. And so he said, we prepared, we put all these things together. It didn't happen. We're going to open the economies because we don't trust you guys anymore. And I took that very seriously. And I think there have been mistakes made by the public health community. There's an ongoing argument in the public health community about, just letting things go so that we reach herd immunity and just locking down every once in a while versus taking the much more aggressive public health approach of testing, contact tracing, and isolation. And these, unfortunately, these debates sort of have spilled out into the world. And then what you've heard is, politicians, news networks saying these guys are crazy. Tony Fauci's been a friend of mine for 25, 30 years. I think Tony is one of the most people with the most integrity that I've ever known in my life. I've worked on 5 different epidemics with him. And, for Tony to receive that kind of critique, it's bracing. It's extremely disappointing, but it tells you where we are. The leadership has to come from the public health community, because this is not fundamentally a financial or economic problem. It's turning into one, but this will go away when we get the public health situation under control. And we are not only, I'm not saying this just as conjecture. This is what we're seeing in the world. If you get the public health problem under control, the economic recovery will follow. Now, as the economy recovers, there are going to be lots of businesses that are going to be different forever. I think the restaurant business is in terrible shape. Travel and tourism, we're not sure what's going to happen with travel and tourism. There's some that are going to take much longer to recover. But, if you look at China, if you look at Korea, if you look at Taiwan, look at Hong Kong, they've been able to go back and forth, sometimes shutting down the whole city, but just for a brief period of time, then getting things back going because they've got the cases down to such a low level.
So two things come out of your comments there I thought were really insightful. And I wanted to ask if you could build on some of your previous experience. The 2017 documentary, Bending the Arc, was about your activities in partnership with Partners in Health with Ophelia Dahl and Paul Farmer. It was about going into Haiti, about going into Peru. The message I took away from that was that a lot of that was about community building. It was about building the trust you say is absent. Is there something from that experience that you could share? Was there some, trick is the wrong word, was there some mechanism to help rebuild that trust, rebuild that confidence?
Well, in Haiti, for example, at first, there was the healthcare in Haiti was terrible. So the thing that brought people to the clinic is that we made them better. We provided tuberculosis care, and people with tuberculosis got better, right? And we heard all kinds of things in Haiti. One of the things we heard all the time was, well, these patients in Haiti, they're so superstitious. They believe in voodoo. They're never going to respond to a westernized, medicine clinic. And so we have a great story. The person one of the co-founders, Paul Farmer, was talking to a woman, and he asked her, and he said, "So what brings you here?" And she started talking about how her daughter-in-law had gone to a voodoo priest and had ensorcelled her, had used sorcery on her, and therefore she'd gotten sick, right? And so Paul Farmer then said, "But I gave you these medicines. You're taking them every day. You're getting better. Why would you take the medicines when the problem is really sorcery?" And she put her hand on her hip and she said, "Honey, are you incapable of complexity?" Right? And we say that all the time because what she was saying is, look, the reason I got sick was because of sorcery. But once it was me that got sick, of course, you guys have effective medicines. Of course, I'm going to take them. So just being effective was the most important thing. And we found that in every single setting. People, the most fundamental thing that people can understand is whether what you're doing is effective or not. And so in every setting, the effectiveness of our care, the commitment of our caregivers, our commitment to training community members who could communicate in the way that only community members can about the things that were available and about their effectiveness, that's what raised the trust. The interesting thing now is that one of our biggest projects is the Partners in Health accompaniment of the United States. So we're working in Massachusetts, we're supporting the city of Newark, we're working in Florida, in Texas. On a smaller scale, we're in charge of contact tracing for the entire state of Massachusetts, and on a smaller scale in some of these other places. But unfortunately, it's in many ways depressingly similar to the situations we faced all over the world. And maybe we shouldn't have been surprised because it's essentially human nature. First, people hate being told what to do by the government. And it's true everywhere. There are very few places where they're so used to it that they respond. But in Hong Kong, interestingly, people started wearing masks before anyone in the government said to do it. They'd experienced SARS in 2003. They knew what the dangers were, and so some societies are ready for it. But in every place we've gone, even during Ebola in Liberia, Sierra Leone, and Guinea, when we were saying you can't have funerals, you got to be careful, you can't go out, the people rejected those ideas, right? But over time, with really clear communication from the head of state, frankly, that's what it took. Really clear communication from the head of state, and the ability of people in power to use their position of power to be clear as you can be about what the science is and what needs to be done. That's really what's necessary. And then the people see it differently, but I think if nothing else, the confusion, the mixed messages, the changed messages, saying one thing one day and another thing another day, that's come from the federal government, and it's not just from President Trump, but from many sources in the federal government, that's been really damaging. And it's led to the situation that I mentioned earlier, that people don't know what to trust.
Can an organization like the World Health Organization compensate for that, or does it get stuck in the same quandary?
Well, it has. And so in 2003, when I went to the World Health Organization, I had actually been one of the people running the campaign of the person who had been elected in January of 2003 to be the next WHO Director General. He's a Korean man named Jong Lee, J.W. Lee. And so I joined, I didn't start working full time until July of 2003, but I started going back and forth from my day job in Boston to Geneva on a regular basis. And February, March were the end stages of SARS. And, the SARS outbreak was managed extremely well. I mean, all the pertinent information came from WHO. There were a set number of spokespeople who got up every day and gave an assessment of where things were. Dr. Gro Harlem Brundtland, former Prime Minister of Norway, was running the show. And she would do things like issue travel advisories. And travel advisories were just that, they were advisories. But I remember she issued a travel advisory for Toronto. And when she issued the travel advisory for Toronto, passenger traffic into Toronto stopped. And so I remember the mayor of Toronto got on TV and said, "Who the hell is who?" Criticizing WHO. Right? So that was a time when countries and cities feared WHO declaring that there were cases in your country. Now, in fairness, SARS was different. SARS was different in some really important ways. It was deadlier. 8 or 9% of people who were infected with SARS across the age groups died, as opposed to, it's still probably around 1% with COVID-19. But the other thing is that the people who had SARS didn't reach their peak of infectiousness until after they were sick. So as soon as somebody was sick, if you isolated them, you could prevent them from transmitting further. With COVID-19, it's totally different. They start being infectious, days before they show any symptoms, and they reach their peak infectiousness around the time that they have symptoms, and that's what makes it so sinister. This particular virus. So during the first SARS outbreak, the WHO did a fantastic job. They did it with very rudimentary technology. They did it mostly with phone calls, and every day they would do a news conference, and this really moved the world one way or the other. I think that's what's needed. I still have great faith. Many of my friends are running the response there. I think they've been saying the right things. I think they've been saying exactly what needed to be done. This was, 4 months ago. What they were saying is, it's the tools we have, folks. You've got to get focused on testing, contact tracing. I just think that the very difficult relationship they had with the U.S. had a very deep impact on them. The United States relationship with WHO is by far the most important relationship for WHO for all kinds of reasons, and not the least of which is on the technical level, the interchangeability of staff members between WHO and the U.S. Centers for Disease Control has always been. There's always dozens, at least, CDC employees who are seconded to WHO. And this constant interaction really informs much of what WHO does. The greatest public health success in history is the smallpox eradication. And smallpox eradication, there were literally hundreds of CDC employees working as part of the World Health Organization team. And so that's traditionally what you want. You want WHO and CDC to work seamlessly together. They did it in Ebola, they did it with HIV, with tuberculosis, with cholera. And the break, and I still don't understand exactly why that happened. That break between the US public health community, WHO, has, I think, been very difficult for WHO.
Disturbing, but hopefully fixable.
I hope so. I think it's actually quickly fixable. Right now, it's just very, very difficult. Yeah.
So the documentary on your experiences was called Bending the Arc. How do we bend the arc today with the WHO, with Massachusetts, with others around the world?
Well, let's start at the smaller scale and then go up. So in Massachusetts, we're very worried. There are more than 100 colleges and universities in Massachusetts, and they're at varying levels. Some have already decided to go completely online, but at varying levels, they're going to have students back on campus. And when they do, no matter how careful you are with social distancing, it's essentially, if they all come back, 100 plus cruise ships coming into dock, and they're not docking just at the harbor, they're docking everywhere. And I think Massachusetts has a fantastic plan. They have a plan for contact tracing. They have a plan for testing. They've got a lot of testing capacity. I mean, they've got as good a plan as anyone. But the situation there is going to be hard. And now I hope, though, that by showing that Massachusetts will do better than other states, and Massachusetts will be able to run down infections, the example of Massachusetts will start spreading. And there really is no replacement for social distancing, mask wearing, testing, tracing, isolation. There's really no replacement for it now, even if there is a vaccine. So I hope that the state does well, and I hope it serves as an example. I think, going forward, we need the government to somehow re-embrace science and evidence. It seems crazy to say that, but that's where we are right now. We have lots of people who are suspicious of scientists, who are suspicious of public health people, and that has to change. Part of it, I think, we have to get better at communicating to people who have experience in public health. But, I think Tony Fauci has been a great communicator. And it's just that, he's had to work against things like, outright criticisms of him from people inside the White House, people on Fox News that just really make no sense at all. I mean, they make no sense at all. And so, how will we get there? I'm not sure. But if we don't pay attention to the actual examples, to the actual data, to the science of this, if we don't get back to respecting that, then I think we're in for a very long, very difficult path ahead.
Thank you. I really do appreciate your insights, and that the logic of what you have just said resonates extraordinarily well with me, and hopefully will resonate farther as we go forward. I'd like to end with two questions, or your insights into two questions for students. I note with pleasure that you enjoy both the theory and practice of international affairs, have come back and forth to academia, being the president of Dartmouth, having taught at Harvard. Given your understanding of how the world works, given your assessment of the pandemic given your ideas about its implications for the global economy and beyond, what advice would you give students who are interested in pursuing careers in international affairs today? How should they prepare themselves?
Well, I think, first of all, I think, one of the reasons I was very happy to be able to be on your program is I think one of the program you're running is more important today than it ever has been before. That the ability to communicate across cultures, across languages, to be diplomatic and to understand what that means. This is so critical. I think that, ironically, it was, I was sitting in Davos. I used to be, when I was at the World Bank, I was on the board of the World Economic Forum. And I was in the front row in Davos, sitting next to Joe Biden when President Xi made his very famous speech a few days before President Trump got elected. And he said something that will always stick with him. He said, the global system is like the ocean we all swim in, and any effort to turn it back into lakes and streams will fail, right? And I actually looked over at Vice President Biden, and I said, "Wow, that was unexpected." And he said, he could have given this speech at the Democratic Convention, right? Now, you can critique the various things that have happened in China as much as you want, but President Xi was saying something I think very powerful, that it's just impossible to go back and just look inward. And so the statecraft, diplomacy, how you are able to negotiate with others who have very different views than you. These are so important. If there's one thing I would say is, as you get your master's in the program at Georgetown, think about getting another skill. Right? So for me, I've been thrown into various worlds where I had to get lots of new skills in a short period of time. Academic administration was one. Budgets, I've done fundraising in so many different environments. But then when I went to the World Bank, I had to learn finance. I had to learn macroeconomics. I had to learn about climate change. There's so many things that I had to learn as a skill. Now, I'm jumping into now new areas where in the private sector that I'm still a student. I'm learning new things. I'm digging my head into textbooks on corporate finance, because I need to know the details of what's going on in our deals. And so I would just say that don't be very glad that you're in the program that you're in, because learning how to deal with people from other cultures, other systems, other points of view is as important as it's ever been. But then if you can bring something else to it, for example, if you were to study climate change, or if you were to study infectious disease, or if you were to study corporate finance, these are all things that, in addition to what you learn in the master's program, will serve you very, very well going forward. I mean, I think things will get better. I mean, everyone's worried about the relationship between China and the United States, but it's very much in the interest of both China and the United States to have relationships, whether they're just economic or political otherwise. And so whether, whoever wins the election in the United States in November, I think the relationships will get better. The globalized, is this a time when the world is going to become less globalized? I wouldn't bet on it. I wouldn't bet on it. I think, I don't know if travel will recover anytime soon, but connecting with people all over the world is going to be a part of our lives forevermore. And coming to the world of diplomacy and service with a concrete skill that you can bring to the table could be very helpful.
Thank you. Thank you very much. One last question. Are there particular opportunities you see in the future? We're in the middle of an extraordinary challenge, but is there a silver lining here? Have we learned something about one another? Have we learned about engagement or about the types of problems we might address in particular ways that could create opportunity for the future?
Well, here in the United States, I think one of the things we've learned is that the inequalities that are quite literally embodied, right? That, for example, the fact that such a high percentage of African Americans, Latinos, and Native Americans are getting infected and also dying in much higher numbers. I think it's shown us that there are holes and weaknesses in our healthcare system that we should improve, and that that there are things that we need to do to get the entire world ready for these kind of viruses. The thing, if I were to say, what if you were really to push me on this, I'd say, people, the infectious disease doctors, and for that matter, folks who focus on the climate, infectious disease doctors have been saying for decades that this kind of virus, could happen, and that there was, the only reason that it hadn't happened yet is because we were lucky, right? We've known this for a very long time, but now that everyone knows this, will there be a difference? I hope so, and I think what will happen is that we'll think more about developing functioning public health systems. The U.S. spends a huge amount on healthcare, but only 2.5% on public health, and the other 97.5% is spent on medical care, and medical care that is often very late, very expensive, of usually very high quality, but of dubious usefulness. And so, can we change the healthcare system as a result? I think all these conversations will take place. But on the bottom line, I think, is that as public health becomes more a part of the overall conversation, I hope that what people will realize is that nature can kick our butts, not only in the form of viruses, but also in terms of climate change. And so, what are we going to do to get ready? There are ways to do it. I mean, BP made a just extraordinary announcement about how they're going to decrease their fossil fuel footprint. There are things happening now that could lead to a better world for everyone, and of course, that's what we all want.
That is a very optimistic way to complete our discussion. I hope you are right, and I look forward to meeting those challenges together. Thank you so much for your comments today. Thank you so much for sharing your thoughts and your insights with our students and with others in the symposium. It's greatly appreciated.
Well, good luck with the class, and good luck to all of your students. I'm hopeful that they'll come out and solve these problems that we've been talking about.
Thank you very much.
Thanks.
Such a fascinating conversation with Dr. Kim. So much optimism, so much wisdom, but a lot of challenging statements for us to unpack as well. Let me pull out several points from the conversation. First, he talked about the importance of expertise and the importance of truth. We have to reflect on what does that mean in the current situation that we're facing with the pandemic, but also what does that mean when we get out of the pandemic, of how we will build or rebuild trust in institutions, in expertise, and in truth. Second, he talked about the linkage between health and our response to the health pandemic and the rebuilding of the economy, providing several examples of countries which chose to aggressively attack and deal with the health situation in order to get to a point where reopening the economy is possible. We have to reflect on where do those linkages exist, and to what extent is prioritization or sequencing of one policy before another important. And finally, he gave the interesting quote about our global system is like an ocean, and any forces that push us towards lakes and streams will fail. We have to wrestle with, is that an accurate statement that we agree with? And if it is, what are the steps that we need to take to push back on the forces that are pushing us towards lakes and streams? And what are the infrastructure development things that we need to consider as we're thinking about how we sustain a global system that looks like an ocean? There's a lot to unpack from what Dr. Kim shared with us, and I look forward to our conversation together.